Narcissistic Personality Disorder, or NPD, is a mental health condition that affects how individuals perceive themselves and others. Those with NPD have an inflated sense of self-importance, a deep need for admiration, and often a troubling lack of empathy. These traits not only impact their relationships, but also cause significant emotional distress. In this video, we'll explore what defines NPD, its symptoms, potential causes, and the treatments available to those affected. Narcissistic personality disorder is classified as a cluster B disorder in the DSM-5, characterized by dramatic, emotional, and erratic behavior. People with NPD often display grandiosity, an exaggerated sense of self-importance, paired with fantasies of unlimited success, beauty, or power. To be diagnosed, an individual must exhibit at least 5 of the following traits: grandiosity, a need for admiration, a sense of entitlement, exploitative behaviors, lack of empathy, envy, and arrogance. These symptoms must persist across multiple areas of life to warrant a diagnosis. Let's start with cognitive symptoms, which primarily involve how individuals with NPD think about themselves and the world. They often exhibit grandiose thinking, overestimating their abilities and feeling they are more special or unique than others. This belief leads to a sense of superiority. Many are preoccupied with fantasies of unlimited power, success, or beauty, convinced that they are destined for greatness. However, when reality doesn't align with these beliefs, they struggle to accept it, often perceiving criticism as an attack on their self-image. Emotionally, individuals with NPD might appear confident on the surface, but beneath that exterior lies a fragile self-esteem. They rely heavily on admiration from others to feel worthy and may react with anger or withdrawal if they don't receive the praise they expect. The need for constant validation often masks deep insecurities. Additionally, many people with NPD experience intense envy, either believing others are envious of them or feeling envious of others' success, beauty, or power. Behaviorally, people with NPD often exploit relationships to meet their own needs. They may manipulate others, showing little regard for how their actions affect those around them. Their arrogance and lack of empathy can lead them to dismiss or belittle others, which makes forming healthy, balanced relationships difficult. This is a common pattern for individuals with NPD. They tend to see relationships as transactional, where people are only valued based on how they serve their self-image. Because of these behaviors, their relationships, both personal and professional, tend to be turbulent. Individuals with NPD often experience feelings of entitlement and expect others to cater to their needs. When these expectations aren't met, they may become angry or withdraw from the relationship. Their lack of empathy and superficial connections make it hard to form deep, meaningful bonds with others. As a result, they may go through life feeling isolated, despite their outward appearance of confidence and control. The exact causes of NPD are still being researched, but several factors are believed to contribute. Genetics may play a role. Individuals with a family history of personality disorders are at a higher risk of developing NPD. Certain personality traits like impulsivity and emotional dysregulation may be heritable. Environmental factors also play a significant role. For example, children who are excessively praised and treated as superior may develop narcissistic traits. Conversely, children who experience neglect or emotional abuse might develop NPD as a defense mechanism, creating a grandiose self-image to protect themselves from feelings of inadequacy. Inconsistent parenting, where a child experiences instability in affection and attention, can also contribute to the development of narcissistic tendencies. Lastly, psychological factors, such as low self-esteem, play a crucial role. Individuals with NPD often mask deep feelings of inadequacy behind their exaggerated self-image. Emotional dysregulation is also common, leading to defensive or aggressive reactions, especially when faced with criticism or rejection. Treating narcissistic personality disorder is challenging, but it's not impossible. The cornerstone of treatment is psychotherapy, or talk therapy, which can help individuals develop a more realistic self-image and healthier relationships. Cognitive behavioral therapy, or CBT, is particularly effective for helping people with NPD recognize and challenge their distorted thinking patterns. Dialectical behavior therapy, or DBT, helps with emotional regulation, a common issue for individuals with NPD. Schema therapy and psychodynamic therapy aim to dig deeper, uncovering the childhood experiences that may have contributed to the development of NPD. These therapies help individuals understand the roots of their narcissistic behavior and work toward healthier ways of interacting with others. In addition to therapy, group therapy can be helpful by providing a structured environment where individuals with NPD can receive feedback and practice their interpersonal skills. Though it can be difficult for them to accept criticism, this setting allows for growth in empathy and self-awareness. There are no medications specifically approved for NPD, but co-occurring conditions like depression and anxiety can be treated with antidepressants, mood stabilizers, or antipsychotic medications. However, for NPD itself, self-help strategies and lifestyle changes can complement therapy. Learning to practice empathy, being mindful of others' emotions, and engaging in genuine mutual relationships are key steps toward improvement. Developing emotional regulation through mindfulness and meditation can help individuals with NPD become more aware of their thoughts and reactions, leading to better management of stress and criticism. Narcissistic personality disorder is a complex and often misunderstood condition. It affects not only the individual, but also those around them. However, with the right therapeutic interventions and a commitment to personal growth, individuals with NPD can build healthier relationships and lead more fulfilling lives. If you want to dive deeper into mental health topics and better understand yourself and those around you, subscribe to our channel for more insightful content. Thank you for watching. Don't forget to hit the like button if you found this video helpful, and subscribe to our channel for more videos on mental health and wellness. Stay tuned for our next topic.